So a code blue thread was just posted about less than 24 hours ago on the nursing subreddit. And before you click away, because you're not a nurse, if you're an allied health professional, heck, if you are just an American and you work in this society, you should definitely pay attention to this video because Congress may be coming for you. And that is quite literally the title of this thread on R Nursing on Reddit less than 20 hours ago. Basically, a letter was sent to the White House and signed by 200 members of Congress trying to cap nurse pay and manipulate our supposed free market. And we talk about the free market in healthcare, right? We want it to be privatized. We don't want a universal healthcare system. And that's what we're getting, a free market. And this is a legit document. It's off of house.gov, so government website. And this letter was actually written on January 24th, so we're a little bit late finding this out. At this point, you can pause the screen to read the letter instead of having me read it and screw it up before I go into my commentary. I'm tired of seeing this narrative that they're using the COVID-19 surge and basically playing into our emotions and making the situation sound like it's dire. And I'm not downplaying that pandemic by any means, but them using this as a narrative to use for their agenda, I think is not right. And as the original poster mentioned, for the 1% that keep on going about how there's, quote, nothing in the article saying that there's literally going to be cap wages, because the writing's on the wall. Basically, someone, okay, probably these organizations or facilities, hospitals, they want to cap wages because they feel like they're having to pay so much for their temporary workers that they're hiring, these nurses from these staffing agencies, and it's, quote, ballooned up because of the situations going on. Look, there's a pandemic going on. There's a labor supply issue of not enough nurses. A lot of nurses are quitting and getting burned out, and basically they need to fill these positions. Well, I think the top commenter, B. Stassi, made a really good point. This narrative that the article endorses ignores that the need for travel nurses started because of the hospital refusing to competitively pay their nurses, taking advantage of nurse culture, I would say healthcare culture in general, and enforcing unrealistic expectations on their staff. This led to massive burnout and an absolute mass exodus from bedside nursing. I would say in healthcare in general even. And if you have heard about the ThedaCare controversy, it is the same story. Basically, the CEO wrote a letter and it started this big controversy. 7 staff members of a healthcare going to a competitor because we're in a free market here. And I think just getting revengeful and salty that they quit. And it's not like these workers who left didn't try to negotiate. They offered counter offers, they gave them time, but the hospitals were just like, nope, we're not going to do it. We're not going to increase your wages. We're not going to offer more competitive packages. We're not going to give you a better work-life balance because, hey, if we do that to, say, you, we're going to have to do that for all of our staff or whatever. Well, the other hospital was willing to pay and they went there. And this is exactly the same story of what's going on. I would argue not even just hospitals. Other facilities, even such as skilled nursing facilities, are probably losing staff members because they're getting burned out. They're not getting paid enough. And look, we're not, of course, all about the wages. I would say that most of us are doing this job because we want to help people. But the job is getting really hard. We're in a pandemic. There's the C word going on, and we're not getting enough support. There's not enough staff. We're not getting the supplies we need, the equipment, PPE, and it's just a repetitive cycle. The system is getting really strained and there's no end to it. Nurses and healthcare workers are getting burned out. So going back to the Theta Care situation, and basically I would say the same story of what's going on. This document, I think, spells it out really nicely. It's from actually the Theta Care controversy in the case. And I think it's written maybe by the lawyers. I don't know how to interpret the legal side of things, but I think it really summarizes what is going on. Theta Care Inc., plaintiff versus Ascension of Wisconsin, defendants, and in an introduction it says, your failure, which is Theta Care, to prepare is not my personal emergency. Evidently, that concept is lost on ThedaCare. With this frantic last-minute lawsuit, ThedaCare attempts to convert its own poor management into a disruptive personal emergency for everyone, anyone but itself. Ascension, which is the other party where the healthcare staff ended up working for and leaving for their new job, and worst of all, 7 essential healthcare workers who, until Friday, believed they were starting new jobs on Monday morning. The evidence already emerging confirms that ThedaCare's emergency is entirely of its own making. And this really reiterates what's going on. Healthcare workers are not feeling valued. They're not getting paid enough for what they are doing. They're not getting the support they need. They're not having a good work-life balance. So if another company offers that, it kind of makes sense to leave, especially if the team that you are working with is so tight-knit and works really well, and if even one of them got fired unjustifiably, it kind of makes sense to have the team stick together. I think it's really funny that they mentioned in this letter them talking about specific numbers, about the staffing agencies taking 40% more of the amount charged to the hospitals for themselves. Look, the hospitals do not need to hire from these staffing agencies. The hospitals can go and recruit like a qualified nurse or healthcare professional on the street. But do they want to work for these places? No, because these places are not good employers. They kind of have nowhere to look but these staffing agencies. And in a free market, staffing agencies can increase these prices. And it's not like these nurses aren't aware of the cut that they're getting taken away from them and that's going to the staffing agency. That's a relationship between the nurse and the staffing agency. But what we have here is a bigger problem. Before, the system was working okay in the healthcare system in the United States. Now, with the pandemic, we have a low supply and high demand and a strain on the healthcare system. And the hospitals want to keep things probably running the way that they were and keep things running the same so that they can maintain their profits. But something's got to give, and you can't just keep things the same and expect things to go well. Meanwhile, despite being labeled healthcare heroes, you all know how I feel about that term. We are humans and we can get burned out. So I think this is relevant not only for us as occupational therapists, as allied health professionals, but as citizens who work in the United States. We cannot let something like this pass because I think it sets a really bad precedent, capping wages for a certain sector, for a certain profession, which we really need right now because people are literally dying from the C word, is not a good thing. What if the pandemic goes on for longer? What if it goes on for 5 years? What if it goes on for 10 years? Then throughout this duration, these healthcare workers are expected to have a capped wage in a free market? No way, right? And I expect this will lead nurses to not really even want to work anywhere because it's getting tough. Definitely share this story, this document, this post with friends, your family, because we can't let this happen. If you found this video helpful, give it a thumbs up. I know it may have triggered some of you and I'm sorry, but this is definitely a situation where we can't keep our heads down and not say anything because some people are using the story and playing on our emotions and our fears of the pandemic to use it for their own personal gain. And I don't think that's right.